Hello everyone, it's Alex here. I'm one of the co-founders at Field Doctor, and today, pending the performance of the internet in hospital, we're going to be talking to Dr. Jeff all about men's health. So let me see if I can get him to join. He's joining us from hospital today, so we're hoping that the internet will work. It's the 75th anniversary of the NHS at the moment, and here he comes. Dr.
Wow,
Jeff, how are you?
very
It
good.
did.
How are you?
Yeah, I'm very well. I'm very well. Well, that's the first hurdle, was getting everyone involved and getting you online.
Cool. That's great. I expected far more technical difficulties, but I'll accept that. That's good.
Well, it's lovely to meet you. To everyone who is currently watching, this is the road test and the real thing live. We didn't have a chance to test it this morning, unfortunately, so we're going to jump straight in. But I think maybe if we kick off with a couple of intros. I'm Alex, I'm one of the co-founders at Field Doctor. But more importantly, I guess we're here today to talk about men's health, and it'd be great to hear a bit more about you, Jeff, and your background and your involvement, I guess, in men's health.
Thank you. Yeah. So my name's Jeff Foster. I'm a GP with a specialist in men's health. I've done it for just off qualified 20 years, and although obviously I don't look like that's the case. And in the last 5 or 6 years, I've developed a subspecialty interest in men's health in particular. I now sit on the British Society of Sexual Medicine Committee, and we write the guidance for things like testosterone deficiency and erectile dysfunction in men, that kind of stuff. So largely my role is seeing a difficult uphill battle to try and get men's health recognised, because I think largely men have had the run of medicine for several hundred years, but we haven't done it particularly well at looking after ourselves, and as a result men still do actually quite badly in all elements of care. So we're trying to see if we can change that.
Cool. I guess when it comes to men's health, it is, one of those things. As a man myself, I guess we often don't want to talk about things. It's a bit embarrassing, and I guess good to understand what you think is, background to that, and what's it all about, really. Why is that the case?
As in, why don't men talk about it, or why do we keep dying early?
Let's start with the latter, actually. That's probably a much better question.
So there's lots of complicated socioeconomic, psychological and physical reasons why men are simply not kitted out to do quite as well. From a sort of biological perspective, we tend to have higher risk factors for a lot of diseases compared with women, and although women are equally susceptible to certain types of conditions like autoimmune disease or something like that, men often tend to get the illnesses that polish us off sooner. So for example, heart disease is much more prevalent in men, type 2 diabetes is more prevalent in men, suicide rates are much greater, and you can sort of extrapolate that into lots of conditions that end up with really bad outcomes. If you then combine that with the fact that from a psychological perspective, men are still driven to not talk about their illness, and we have a kind of inbuilt personality disorder within all men that says, if you've got a problem, probably don't talk about it, don't speak to your doctor. The best thing is to bury it really deep inside, and then it'll be fine and it'll probably go away. And we still get people coming in now, if you said, oh, I've not been to a doctor for 20 years, isn't that brilliant? And you go, well, not really, because now you've got diabetes. And the other issue, I guess, is the more sociological and socioeconomic pressures. So we still, despite efforts to change the way we talk about male and female health, we still largely do stereotype for children. For example, my son's rugby team, if they get hurt, you say you don't cry like a girl. keep your emotions tight. Don't show that you're upset. It's just a bruise. Whereas, of course, in my daughter's sports, they're encouraged to, if they get hurt, to go for a hug or feel better about things. And that is these little surreptitious things that start to creep into your psyche at a young age that then have massive health ramifications 20, 30 years down the line.
I think it's right that 1 in 5 men die before they're 65, which is an incredible, incredible statistic, and something that, you know, like you say, really shouldn't happen. And is it a lot down to lifestyle, do you think, that with a lot of those, I guess, ways that men die, be it type 2 diabetes, cancer, etc., sort of are they often linked to lifestyle choices, as well as, I guess, not looking for the preventative measures during life?
I think it's both. I don't think you can ever really separate one from the other. And I think lifestyle choices are often a conscious and unconscious decision of how you feel. So you are much more, for example, likely to eat more healthily if you have a positive mindset. And if you're not depressed and you have a good outlook of what your day is coming, you're far more motivated to cook food healthy and to plan your day better and to exercise and to get better sleep. And of course, the converse is also true. So lifestyle is the inevitable consequence of chronic disease, bad mental health, and poor socioeconomic choices.
Yeah. So any, not even sort of top tips, but what would you advise men to do? And I know, looking just at people who are joining us, you know, our follower base, I think, on Instagram is largely female. Therefore, how do we then get that message to the men in our lives to do things differently?
About 40% of the patients I see in men's health clinics are there because their female partners or wives or friends have told them, you need to come and see a male doctor. We've tried various measures in the past to try and target men directly. And as we sort of discussed already, they're not particularly a great group to engage. If you really want to get guys to see doctors, a really good way is to hound their female partners or friends, because they're much more likely to listen to the advice that we give. There's the idea of touch points, of course, in how many goes it's going to take for a person before they'll engage or before they'll speak to their doctor. And men require more touch points than women before they'll act on an action. So I think having women on board who are able to take these sort of notes ahead is actually really, really useful. In terms of specific things, one of the best examples we have for hormone problems, so testosterone deficiency in men, is menopause in women and perimenopause. And because testosterone deficiency affects about a quarter of all men at some point in their life, there's just off a million men, diagnosed in the UK already, but a lot of guys don't really know about it. And the converse of that is, of course, menopause affects every woman at some point. You can kind of predict roughly when they're going to get it within a sort of age range, but a lot of men with low testosterone will exhibit exactly the same symptoms. And it often takes the female partner to say, hang on a minute, I feel awful, you feel awful, but I've started HRT and now I feel brilliant, but you still look awful. And it's that to then get them to go see their doctor. So having that reflection to go, actually, something's not right about how you are, is a really good impact. There is the idea that if you run the journey together, you do much better. So 2 people that feel rubbish is terrible, but at least you both feel rubbish and neither of you want to go do anything, and neither of you want to have sex, and neither of you want to go exercise. If one of you starts on HRT and suddenly feels brilliant, then of course the disparity between the one that still hasn't had treatment becomes much more obvious. And I think that's part of the reason that we do get men coming in later, because of course their partners are like, wow, I feel amazing now. Yeah. Why aren't you doing the same sort of thing? So I think female side is an enormous thing. Yeah.
And just on that area of testosterone deficiency, similar interventions to menopause and HRT would be the prescription, I guess.
Yeah. The main difference is that around 90-something% of men will have age-related decline of testosterone, just like women have age-related decline in estrogen, and that's fine. But there's still a much, much larger lifestyle impact on testosterone in men, and lots of data. So the biggest cause is still age, but the second biggest cause is obesity. And if you're simply overweight, you're producing more estrogen, you produce more insulin resistance, and you actually directly make your muscle smaller. So the idea that when a guy is large and he looks down and thinks my bits have shrunk, it's not an illusion because their belly's bigger. It generally does shrink. Yeah. And you have to try and reverse that. So lifestyle factors, exercise, what you're eating, what you're dieting, how your sleep is, have an enormous impact on testosterone production. We actually say that as a guy, you should be somewhere between sort of 10 and 15% in terms of your body fat levels, and that's your optimal testosterone production range. As I'm sure you probably know more than me, most guys are now hitting way above 15%. So we're going to see quite a lot of low testosterone patients coming through.
Yeah. And in terms of getting the message out there and awareness, obviously there've been some, I guess like Movember has done an amazing job, I think, in terms of opening up some awareness around men's health. There's, and particularly around, I guess, prostate cancer initially, but then mental health more latterly has come in as part of that. And then there's Men's Health Week, which probably a lot of people didn't know existed, which has just passed in June. But where else can people and men or the women that see them, I guess, potentially showing symptoms and could go for information, where would you signpost them to?
Quite tricky, isn't it? Because I guess the big problem you've got with low testosterone is a lot of people, men and women, don't know about it. A lot of doctors don't know about it. So you've got this real unconscious incompetence that's coming in where your patient comes in, they says they feel rubbish. The doctor doesn't really know to look for it. So neither of them are well serviced out of it. In terms of primary sources of information, what we really, there's things like the British Society of Sexual Medicine, and they have a guidance page for doctors to look on it. My website in particular has a sort of patient-friendly site that you can look for information on testosterone deficiency, and then always there's the easy ability to just plug my book, which has a whole chapter on testosterone deficiency. I personally say that's the best option, but there's lots of things available. I think realistically what we actually need is a sort of male Davina, in a sense.
Yeah.
Because menopause was suffering very similar difficulties maybe 5-10 years ago, and certainly when I started med school there was no discussion around menopause. There was no discussion around HRT, and yet now, of course, it's massive. So what we really need is a celebrity, somebody who's willing to poke their head above and say, actually, we can educate wider good about the benefits and problems of low testosterone, and then information will just go ballistic, and it'd be great.
I think what Davina's done has been, pretty incredible. And like you said, I think it needs that awareness piece to help it rise above the parapet. Obviously, you talked about body fat levels as an example, and I guess for men and women at the moment in the world at the moment, and I've got 2 young girls, and certainly body image and body awareness is something that's always top of my mind when I talk to them and think about them and where they're looking on the internet. And certainly for men's health, as you said, someone what's men's health, you can Google it. What comes up is pictures of ripped blokes still, front covers of Men's Health, and protein. But what's your thoughts on sort of, I guess, thinking about how we maintain that body fat level, but also diet and lifestyle? Any sort of basic tips, because ultimately I guess we need to be thinking about how we prevent things happening before we have to then move to curative methods.
Yeah, we spend very, very little time, certainly just because of availability in the NHS, looking at preventative and health optimization, which is really what we should be doing, but there just isn't that ability to do that sort of thing much now. From a preventative health mechanism, I think often the supplement industry has done an enormous amount of harm in terms of what it does in terms of promoting male health and what is good diet and what is good supplementation, because it tends to rely heavily on the idea that you must have protein all the time in an enormous amount in an artificial structure, And I've got nothing wrong with people eating buckets of protein. I don't care. Unless you're on dialysis, I don't think it really matters too much. But the question is how you obtain that protein and whether you really need that much. And I think there's unfortunately, as much as you might state something as a doctor and say, I don't think you quite need this amount of protein, it's very hard to compete with a £2 billion industry that's able to say, actually, look, here's all the adverts that says you need this. And it's so ingrained that even when I started training when I was 16 and used to buy Muscle and Fitness or something, it was protein powders on all the pages. I mean, admittedly, they were full of sugar then, so not so much now. But even so, it's protein powder, and still is this idea that we must do this. I think there's generally very little evidence that most of the supplements we buy are going to make much of a big difference in terms of what we actually do. And sadly, it's really frustrating. In fact, even in the BBC News today, there's a thing about SARMs. So you can buy effectively precursors to steroids from supplement shops at the minute, and they're classed as safe drugs. You know, they're not. They're incredibly harmful, but it's a very unregulated market. If you're going to look at life, if you look at health optimization, health prevention, then yes, body fat is a massive thing. Body image is another massive thing for guys, because we don't want every guy thinking that he needs to be stacked with a six-pack by the time they're 16. And that's having an implication for younger guys using steroids, which is obviously a terrible thing in terms of general health and where we're going with it. And I think also as you get older, we should be thinking more about health checks and how we maximize the idea of what we can look for before it happens. So the NHS did the health check, and the NHS offers the health check from the age of 40, and you get one every 5 years until you're 74. And it's not bad. And within the confines of what the NHS can offer, it's pretty good. You know, it'll screen you for diabetes, it'll check your cholesterol, it'll check your blood pressure, your kidneys. If you want more than that, then of course you can't do that on the NHS, and it's not a realistic thing. And I think we do need to consciously be thinking as a male society, do we need to be investing our own money into preventative health over time? That's something we all need to start thinking about. You pay 350 quid a year to service your car, and yet for some reason the expectation is that your health will be free. And whilst reactive health is free, if you have a heart attack, if you get hit by a car, if you get a chesty cough, maybe we should be thinking that preventative health is something we need to sort of almost pay for, and we need to think about proactively. So yeah, so we offer different health checks, and the idea is we're trying to prevent stuff so that you never need to see that cardiologist.
Yeah. And that NHS health check at 40, so I'm through that mark, not by much, well, actually a decent chunk, 10%. But is that something that GPs should offer and reach out to people when they hit that mark, or is it something that people need to request?
It's down to the individual funding of that area. So in theory, it's available to everybody. And in most practices, so we try and promote it as much as possible. However, it's everything in the NHS is down to what is paid for or not. And there are certain funding streams that will simply take that away and say, actually, pay you to do that anymore. The difficulty you've got in the NHS system is that everything is being squeezed in primary care so tight, and it's getting smaller and smaller and smaller, and they don't put money into anything new, which means that sometimes you can't offer the service you'd like to because there's simply no money to do it.
So, and that would be the same for men and women at 40. It should be available. And if someone wanted to have that, could they then walk in and say, please, can I have it? Can they request it? And then the GP would have to find the funding, or would they might say no?
Funding, yeah. If there's no, whether it'll be moved to a more central thing, will they become virtual, whatever else. But if basically the funding stream is taken away, then even if the NHS says we'd like you to have it, someone's got to pay for it, and the practice themselves can't. So I think the best to do generally is, as long as there's no pre-existing that would stop you having a health check. So, for example, if you're diabetes,
I think our connection has gone a bit wonky, Jeff, and I don't know if it's you or if it's me. Back, no, back now. Okay, and in terms of, oh, I don't know if it's whether it's my connection or whether it's Jeff's connection.
I'm very
Just give
still.
it a second.
Okay.
I'm going to ask, as the connection is poor, Jeff, I'm going to ask you a couple of questions. It'd be great to tell us a bit more, I guess, information about your your website, and to understand where people want to go and find some more information, where to go and what to look at. We should definitely get a couple of copies of your book to give away if people are interested, and can certainly look at that afterwards as well.
Cool. That's very kind. So we have two websites. Our business website is a company called H3 Health, and we provide personalized, basically hormone and preventative health care for men and women over 40. We subspecialize in testosterone for men and estrogen and menopause for women. We also do sort of bespoke health checks for men. The idea is we're trying to offer something that's that kind of next level to stop you ever needing to see that doctor. So we're trying to offer something that's a bit evidence-based, is not scammy, and actually offers a realistic evidence point with things that you can do with the information at the end of it. For personal information about stuff that I offer, I have my website, which is literally just my name. So it's Dr. Jeff Foster, and that's more around the idea of what other health prevention we can do. So there's mental health information and physical health and lots of other small things. And of course, there is the book, which is just a larger, more in-depth, although perhaps somewhat dry discussion about all aspects of male health, and hopefully gives a better insight into male health in general. I think largely, if we can just try and elevate the concept of male health to something that is valid and worthy and important to listen to at a wider level, then it'll be this kind of ceiling aspect of health that we've been able to break, and that'd be so helpful to do.
Yeah, brilliant. So aside from finding a male Davina, and I'll put that on my list of things to do, top three things, I don't know, top three tips or top three things that you would recommend, I don't know, men go and do. Is it go and talk about it more, see a GP, read more, think about, be more aware? What do you think? Okay,
so 3 easy things I'll suggest you do, because it'll cover all aspects of health, and it's a quite simple thing to do. So the first thing is, from a mental health perspective, push yourself out of your comfort zone. So the highest rates of suicide are still in men in their mid-40s. Men are terrible at talking, and they're terrible at opening up. And usually what will happen is they will start to become increasingly reclusive, and they'll stop engaging, and they'll stop doing things, and they become increasingly insular. And a lot of these are very, very subtle over time. So if you see your colleagues doing this, and they're not attending for social events, or they've stopped going to the gym, or they've stopped looking after themselves, or they're not even just having coffee in the break at work because you're not all meeting up, then these are early markers. And it doesn't take much just to flip that round. So a really easy thing to do is to say to somebody, we'll go for a walk in our break, and it's tough, you're coming with me. And you don't have to say to them, oh, you look really sad, should we talk about your depression? But just allowing them to have that breakaway and to open up, and over time, that is a game changer in terms of male mental health. If you catch these things early, they often never reach that point where something awful happens. You can also do it yourself, because you can say, hang on a minute, I've realized I'm not going to the gym anymore, and I haven't gone to coffee. And even if it feels a bit awkward and you really don't want to do it, pushing yourself back out into that slightly uncomfort thing can be a really good way of changing how you approach your mental health. Physically, never underestimate the importance of lifestyle. We typically, as guys from about mid-30s onwards, get caught up in the world of being a near middle-aged guy, and we have less time to ourselves. We don't exercise as much as we used to. We have busy jobs. We don't eat as well as we used to. We often get deprived sleep because we've got young kids, or we're trying to squeeze work in the evening, or we're trying to get other social events in for catching up that you've not been able to do for ages. And all those really important things that we keep drumming into people month after month kind of get lost because you think, oh, I've heard that all before, but it makes an enormous difference. You must exercise 3 or 4 times a week. I don't care what the exercise is. And the evidence actually doesn't really matter what the exercise is, as long as it's something that gets you a bit out of breath, or gets your heart pumping, or gets your muscles sore. And you must try and keep your body weight down, and you must try and eat healthily. And all those lifestyle things that you get saturated hearing are enormous game changers in terms of physical and long-term health. And the last thing I would say is, if you are over 35, 40-ish, get a decent health check, pay for it. They'll be like, what, 600 quid probably, 750 quid on our site. But it could be the difference between doing something now, which avoids a problem, which you can treat and resolve and reverse, or waiting 5, 10, 15 years, and then something awful has happened. And I think we need to be much, much more proactive in saying, can I prevent an issue? And by doing that, it's well worth the money.
Yeah, amazing. Well, Jeff, that's certainly been enlightening for me, particularly on the concept of being able to go to my GP and ask for a health check. And I would certainly put myself down as one of the people in the past that would not go and talk, and would not knock on the door, and would not say, I've got a problem and look at this. So I hope that's been really helpful for people watching. Jeff, this has been really excellent. And the Wi-Fi into the NHS, despite it being 75 years old this week, hasn't been too bad. It may well have been mine in my terrible shed at the bottom of my garden. But we should do this again at some point, talking about another topic. But yeah, thank you very much. Thanks all for joining us. And I will now try and save it so that it sits on our feed and we don't lose it.
Thanks again. Cheers.
Have a great rest of your day. Cheers.
Bye-bye.
Bye-bye.